Welcome to mededmarket. Learn high-yield concepts that appear on every Step 1 exam. Today we are focusing on behavioral health. A 24-year-old woman is brought to the emergency room 1 hour after she ingested 12 pills of acetaminophen. She had a fight with her boyfriend immediately prior to the ingestion, during which she threatened to kill herself if he broke up with her. She has been hospitalized 4 times for overdoses in the past 3 years, following breakups with her partners. On the way to the hospital, she screamed and then assaulted the paramedic who attempted to take her temperature. Physical examination shows multiple rows of well-healed scars bilaterally on the wrists. This patient is most likely to display which of the following defense mechanisms? Is it fantasy, reaction formation, sublimation, displacement, splitting, or controlling? A defense mechanism is one of the primary tools of the ego used to cope with external stressors to avoid or reduce anxiety, restrict impulses, and avoid unpleasant feelings. It is mostly unconscious. Let's review the defense mechanisms first. Level 1 defenses are pathological or narcissistic. They are seen in children and adults with personality disorders. Splitting. The person has an all-or-nothing view about a subject or the other. It manifests as extreme views of either all good or all bad. This is associated with borderline personality disorder. Think of it like an angel and a devil sitting on your shoulder. Only one gets to speak at a time. An example might be a woman who loves all veterinarians because they helped her cat once, but she hates all doctors because she didn't get the pain medication she asked for. Projection. The person attributes their own unacceptable thoughts, feelings, or motives to others. Instead of acknowledging and dealing with these undesirable aspects within themselves, individuals project them onto someone else, perceiving others as possessing those characteristics or motivations. An example of this might be a married man who feels attracted to other women but accuses his wife of cheating on him. He has an undesirable aspect within himself, which he projects onto his wife, even though she has not cheated on him. Denial. This is characterized by the refusal to accept or acknowledge the existence of a reality or the truth of a situation. Individuals using denial may avoid facing unpleasant or distressing aspects of their lives, creating a psychological barrier to protect themselves from the anxiety or discomfort associated with the truth. It is a common early response to receiving bad news and is associated with substance use disorder. An example might be an elderly man who refuses to acknowledge a cancer diagnosis by planning a vacation to France and avoiding going to any chemotherapy sessions. Distortion. This involves a person altering or misinterpreting reality in order to cope with stressful situations or emotions. This distortion of reality can involve reshaping facts, perceptions, or experiences to make them less threatening or more acceptable to the individual's psychological well-being. An example might be a woman who tells a story about how she was abandoned by her family when she actually ran away from home, or a man who tells his friends that he broke up with his girlfriend because she was cheating on him, but in reality, he was the one who was broken up with. Here's a quick recap. Splitting is when you characterize things as all good or all bad. Projection is to project undesirable aspects of yourself onto someone else. Denial is when you don't want to see it, hear it, or believe it. Distortion is when there is twisting of the truth to make things less threatening. Now let's revisit the question and focus on the important parts. The patient's extensive history of self-harm, the overdoses, cutting, suicidality, extreme effort to avoid abandonment by her partners, and unstable mood are all features of borderline personality disorder. If we presume she has borderline personality disorder, then which defense mechanism is this disorder associated with? This patient is most likely to display splitting, where she has an all good or all bad view of others. Now it's your turn to practice some more. Pause the video if you need more time to answer each question. A 45-year-old patient with a family history of heart disease ignores persistent chest pain and shortness of breath, dismissing the symptoms as mere indigestion. What defense mechanism is predominantly at play? The correct answer is denial. The patient's refusal to acknowledge serious symptoms, attributing them to indigestion, demonstrates the defense mechanism of denial, where the individual avoids confronting uncomfortable realities. A medical student, feeling insecure about their academic performance, frequently accuses classmates of being incompetent and suggests that they will likely fail their exams. What defense mechanism is the student primarily using? The correct answer is projection. The student projecting their own fear of failure onto others by accusing classmates of incompetence is an example of the defense mechanism of projection. After receiving a poor evaluation at work, an employee convinces themselves that their supervisor is biased and incapable of recognizing true talent, minimizing the impact of the evaluation on their self-esteem. What defense mechanism is this person employing? The correct answer is distortion. The individual's reshaping of the evaluation as a result of bias, minimizing its impact, aligns with the defense mechanism of distortion. A patient in therapy describes their therapist as the most caring and understanding person in the world during one session but views them as entirely indifferent and unhelpful in the next. What defense mechanism is evident in this patient's perception? The correct answer is splitting. The patient's extreme and rapidly shifting views of the therapist as either entirely positive or negative are characteristic of the defense mechanism of splitting. A patient, struggling with substance abuse, adamantly denies having any addiction issues while repeatedly expressing concern about others in the rehab group having severe problems. What combination of defense mechanisms is most apparent? The correct answer is projection and denial. The patient projecting their own addiction issues onto others while denying their own problem reflects the combination of projection and denial as defense mechanisms. Well done. Today we have covered Level 1 defense mechanisms in this video series. Check out the next video for immature, neurotic, and mature defense mechanisms. Don't forget to like and subscribe for more high-yield practice, and join the Med Student Discord community at mededmarket.com.